was a courier in the fall of 2003. And actually stayed on after I finished the courier program and did some work for Wendover as a courier coordinator and a tour guide, and also worked for the midwifery school temporarily for quality assurance. So I've done a few things, and a few more times over the year have worked as a courier coordinator. As a courier, so I was here about 3 months, and I kept a regular schedule weekly, but it was different every day. One day a week I would go on home health rounds with a nurse from the hospital. I love doing that. One day I would shadow at the clinics, at various clinics. I think I was most often at Kate Ireland in Manchester. There was a clinic there at that time, where I shadowed a nurse practitioner who's still my very good friend to this day, can say. I did that. I also worked at the Adult Learning Center, which I loved. We did a lot of math tutoring and things like that. And then I also spent time at the animal shelter. What I loved the most was just getting to know the people, like the staff at Wendover I spent a lot of time with. And they liked me, I guess. They were nice to me enough, of course. And I just, I don't know, that was just experience that I loved, and a lot of it was new for me. I'm from a very suburban northern upbringing, so just the mountains in general, getting out and exploring, traveling, all that was new, and I mean, I liked it. I didn't have a lot of healthcare exposure before I came to the Courier program, so shadowing the nurse practitioners that I did, going on home health rounds and everything like that, was really informed most of my healthcare knowledge, and kind of somewhat with home healthcare and with the school-based clinics that I was talking to you about, just showed me how important, particularly in a rural area, is to bring the practitioner to the person. And I don't just mean physically also, but the kind of you know, the nurse to the need type thing, like really paying attention. The nurse practitioners I shadowed, they were interested or understood and took into account other things that were going on in the patient's life. They knew them well, many of them. I think that was a rural area type thing. Knew their families, knew to ask about different people and what was going on in their life, and how different factors in their life kind of affected some of their health issues. That, I guess what it showed me is that health and healthcare, there are a lot of, I don't know, tentacles to it, like different parts of your life affect that. You think it's just you go in and take care of this one body part or this one health issue, but that there are other things related to that that have either caused that or you know, influenced that. It showed to me how important it was for a nurse practitioner around here in particular to understand all the barriers to healthcare and the factors to why their patient maybe couldn't get the medicine or couldn't come to the appointment, or, you know, can't go to Lexington for more extensive care, things like that. So, I mean, it was a complete learning experience for me. It really just, it will change your life. And I don't necessarily mean you're gonna move here and live here like I do, but it's just, you take something away from this that you can't get anywhere else.